Dr. Tiara Marthias is a health systems researcher at Gadjah Mada University's Faculty of Medicine, and she joins us out of Jakarta. Dr. Marthias, these are very interesting figures, but what does it tell us that there was antibodies in so much of the population, and that was around March, which was well before this current outbreak?
Yes, it is a testament, I think, on how low our testing rate has been in Indonesia, and that implies that our tracing and tracking is also not really effective so far for controlling the epidemic. And you're absolutely right, since it came in late March and that our Delta variant occurred around early May in Indonesia, could be higher now since the spread of the disease is much more rampant compared to the previous variants. And even though we do have antibodies among people in Jakarta, for example, it should not negate the necessity of vaccination, since we do not know if these antibodies are effective against the current variants of the disease.
Yeah, I wanted to ask you about that. So the fact that they are carrying antibodies does not make them immune at this point?
That is true. And previous studies as well around the world have shown that the level of the antibodies would deplete over 2 months' time. And since it's already past March, different variant as well, we should not be saying that, oh, people have antibodies, so we're not going to get sick. And that's exactly what the figures now are saying.
But it would seem, though, that a lot of people were contracting COVID but not getting that sick, or were certainly not presenting through the health system. Which one do you think it was?
I think it's a little bit of both. First, we were not really testing a lot of people, even though the testing capacity has been increased over the last few days or weeks. But also a lot of people are staying home even with mild disease. And we know COVID-19, 80% of people contracting this disease won't have severe symptoms anyway. But those who are, and given the large population of Indonesia, means that they would be hospitalized, and that would mean our health system would be collapsed.
Yeah. So let's talk vaccination rates. You're running at around 8%. That's not a good number when you consider just how bad this current outbreak is.
Yes, it is it's very bad, to be honest. But and also, we have 95% of our healthcare workers vaccinated, but that is mostly with Sinovac, which is 65% effective in preventing moderate to severe disease presentation. But also with the Delta variant, we don't know how effective it is, to be honest. And like you said, only 8% of the general population have the vaccine. There has been now more effort to expedite the rate of vaccination, but it's really a grim situation as of now.
And is Sinovac still the majority of the vaccine that's being used? I mean, there are a lot of doubts that have been raised about Sinovac now.
Mm-hmm. Yep. Like I said, it's 65% effective. It's a bit lower than AstraZeneca and other vaccines. But looking at how protective it is towards the healthcare worker, even though the high number of doctors, midwives, and nurses are dying from COVID, but compared to the general population, which is definitely not 95% vaccinated, the mortality rate is lower. Which implies that the Sinovac does give some immunity, even to the current variant in Indonesia.
So should there be?
So I think the public health message here is get yourself vaccinated, whatever vaccine we have now.
Yeah, you can get. And what about further lockdowns? I mean, there's a very ambivalent policy that really is not effectively containing this.
That is true. I think the economic pressure we have is also impeding the lockdown policy. The policy that we have to gear down now is how to make people able to have lockdown. If people have to go out to earn money. And then that's where the policy should be targeting at, instead of closing down roads and just moving, crowds from big roads to, village roads and stuff. And like you see in Jakarta, main streets are closed down, but 800 meters away, people are just flocking around and with very little control.
Tricky one and really heartbreaking at the moment with the number of deaths. Thanks so much for joining us, Dr. Marthias.
Thank you.